Hi, my name's Gilly Angell and I'm National Coordinator of the LENS, which is the Lived Experience Network. And I'm going to talk really from my own lived experience perspective of healthcare workers. So what are the skills? And I think the skills I feel that I have in my own experience of how they've actually cared for me over a very long period of time is the skills are that sense of listening, so that as they've actually been dealing with me and they've actually listened to what I actually need, and at times also my concerns and my fears. The other thing, and I think this is the ones who were just really amazing, were the healthcare workers who were completely embodied, that you knew that they were not only listening, but they were aware not only of themselves, but also of me. They were completely engaged with me. And it didn't matter if I was in the middle of a busy A&E or critical care or a very large ward. At that point, I was the only person. I was the centre of their universe, and they would listen completely, understand what I needed. And I think finally, there was always that sense as they came to deal with me, to speak with me for the very first time, there was eye contact. And most importantly, there was just often, always an amazing smile. And if I was very, very fortunate, there was a hug. So with regards knowledge, so the knowledge that I required at any point, and often I think you have to understand that if you are very unwell, your actually brain circuit is completely muddled up. So what I always needed, and I think I always got, was knowledge which was very clear and concise. And often they would say that to me a number of times. And in order to do that, they would sometimes play with it. So sometimes they would speak it to me at times when I was completely kind of out of my kind of comfort zone. They would even at times kind of do little drawings or something. Or sometimes they'd come back a bit later in the day and tell it to me in a different way until I'd really understand what was going to happen to me. So in that respect, I really believe that they were actually thinking outside the box, that it wasn't just we have to do this, this and this, but it was a very different way of engaging. Attributes. One of the most important attributes is humour, because at times if one's in hospital, and I think at this time when we're really going through the coronavirus pandemic, is to really see that within this at times real darkness, that there is humour, that there is a lightness of touch, that there is empathy. So at times again, when you are seriously unwell, and you haven't got your loved ones around you, and you're in a very, very different space, and often you're very, very frightened, you don't quite know what's going to happen, to know that somebody standing or sitting next to you, in actual fact, is empathetic. And also that sense of stillness, that, and I feel because I was at times, I had to be barrier nursed very intensely at times in my trajectory through the NHS. So I was very aware of everybody coming into me who were completely gowned up. But even within that, they were able to convey that sense of empathy, that sense at times of just often with 3 or 4 sets of gloves on, they would gently touch my feet. So I knew that they were connected. I knew that I wasn't, although in quotes I was isolated, I knew that there was another human being. And for that, I would always give grateful thanks. And even within all of this, that the healthcare workers actually acknowledge me as an individual. So it's not just that I am a particular disease at this point, but I am more than that disease. I am this person beyond that disease. And that again just gave me for a very long time phenomenal amounts of help. So flowing on to actual art practice, and what are the kind of how does one help kind of, can the arts actually help? Or rather, what are the qualities that the arts can help develop in aspiring healthcare workers? I think in reality that if you look at any art practice, and I think this can be very, very, if we take it the broadest sense of art practice, that what you need to do as you engage in an art practice is you actually need to focus. You're going to maybe make something, dance, do gardening, whatever. So you have to slightly move into a slightly different space already, because you have to engage the whole of your being. So you have to be aware of the other. It's not just about yourself any longer, it's about the other external to yourself. And as you do that, you move into a state of what I would say from my tradition, you move into the state of witness, you move into that state of awareness. You're not quite sure what's going to happen as you, in quotes, begin to create, but something is going to happen. So again, in order to do that, you need to become into stillness to see the busy mind and see where it's taking you, and then very gently just place it to one side. And within that, as the thinking process slows down, you move then into this amazing liminal space. And then anything is possible. You can challenge any form of habitual thinking. And what is fascinating, so at the trust I'm involved with, I sit on the arts committee, we have every year an annual arts competition, exhibition for all our staff. Now, what is absolutely fascinating in the years that we've run that is that a number of our clinicians and healthcare workers already have a background in the arts, that they might have already trained, or they actually do that as very much as a real kind of part-time hobby, which they thoroughly enjoy. So in some respects, I think it's something that the NHS actually has missed a trick on, is that there are a lot of people within the NHS who actually really do engage within the arts, and they are just amazing.